Hello, and thank you for taking the time to watch this brief video providing an overview of the Public Health chapter for the 2026 update to the Massachusetts Rural Policy Plan. In this video, we will review the context regarding rural public health challenges, recent progress made, and review the draft recommendations in the plan. Your watching this video now will allow us to have meaningful discussion during our public engagement meetings for this chapter. When we convene for the statewide feedback meetings, the primary questions we will have for attendees are: does the summary of this chapter's challenges, successes, and achievements feel right and representative of your community? Which of the recommendations would make the biggest difference in your community? And what is missing? The goal of the Public Health chapter is to ensure rural residents have equitable access to strong public health and healthcare systems by sustaining local and regional capacity and using new federal and state resources to close gaps in access, outcomes, and preparedness. Since 2019, Massachusetts has made significant progress in improving rural public health and healthcare systems. The COVID-19 pandemic exposed critical weaknesses: fragmented local public health capacity, uneven preparedness, and limited integration with healthcare systems. But it also led to rapid learning, new partnerships, and sustained reforms. Local boards of health, regional planning agencies, health systems, and community organizations in rural regions worked together on testing, contact tracing, vaccination, and communication, demonstrating the value of shared services and regional infrastructure when individual town departments are too small to respond alone. The subsequent passage and implementation of SAFE 2.0, or State Action for Public Health Excellence, has begun to standardize foundational public health capabilities across municipalities, encourage regionalization, and increase state support for shared public health services, steps that are especially important for rural communities with limited staff and budgets. Nearly every rural health department in the Commonwealth is now part of a regional public health collaborative funded by the Massachusetts Department of Public Health's Public Health Excellence Program. This investment has dramatically improved the quality of public health protections for rural residents. In early 2026, the Commonwealth secured a major Rural Health Transformation Program, or RHTP, award from the Centers for Medicare and Medicaid Services that is intended not only to stabilize rural health care, but to transform it. Through this program, Massachusetts has committed to ensure that rural residents can more readily access services, create more opportunities to improve health and well-being, and scale systems, policies, and investments that reflect rural communities' unique needs. Planned activities include expanding preventative and community-based care, supporting new care and payment models, upgrading facilities and technology, strengthening the rural health workforce, and bringing all rural health entities onto interoperable data sharing platforms by the end of the 5-year program in 2031. Despite this progress in new investment, rural Massachusetts still faces significant public health and healthcare challenges. Increased public health funding brought heightened expectations for all health departments. Rural providers and public health entities are being asked to participate in value-based and population health initiatives, adopt new technologies and telehealth models, integrate into statewide data systems, and engage in regional partnerships, all while managing day-to-day operations with limited administrative capacity and while serving a sparse and large geographic area where people and businesses are farther apart with limited transportation options. Rural residents often travel long distances for primary care, emergency services, specialty care, and behavioral health, and small hospitals and clinics remain financially fragile. Rural behavioral health systems in particular struggle with funding and staffing, even as demand for services related to mental health, substance use, and an aging population remains high. Rural emergency medical services are reaching a crisis point. Many rural EMS services are volunteer-based. Existing volunteers are aging, and fewer people are volunteering, in part because fewer people live and work in the same town, so volunteering is more difficult. Additionally, rural Massachusetts has experienced a disproportionate impact from the opioid crisis over the past decades. In recent years, opioid settlement funds began to flow into cities and towns across the nation. Unfortunately, the national settlement formula is skewed against municipalities and regional school districts because of the data used in developing the formula. This has left some of the towns with the highest opioid overdose rates receiving the least settlement funding per capita, while wealthier towns with local schools receive 10 times what their neighbors do. Although the national formula cannot be changed, 60% of the settlement funds stay at the state level, which is where this disparity needs to be addressed. The Public Health Excellence Program described above that has transformed rural public health delivery currently relies on federal funds that are running out. Significant, stable funding is required to ensure that the gains made since COVID are not lost. Without careful attention to capacity, equity, and local context, and aligning rural health and public health investments with transportation, broadband, digital equity, housing, age-friendly initiatives, and climate resilience efforts, there is a risk that the benefits of these reforms and investments will flow primarily to better resourced organizations or regions, leaving the most isolated and economically distressed rural communities behind. The Rural Public Health Agenda in this plan seeks to align with the SAFE 2.0 and RHTP frameworks and ensure that systems transformation is designed and implemented in ways that are achievable for all rural communities and that recognize the needs of rural residents. The following recommendations are high level. Many of the recommendations in each chapter of the plan include sub-recommendations that speak to specific strategies and tactics regarding how the high-level recommendation could be implemented. We strongly encourage you to review the PDF of the full recommendations for this chapter at the same URL through which you accessed this video. The URL is also cited at the top of these slides. The public health recommendations are: 1. Ensure rural representation and rural equity in the rollout of SAFE 2.0 and the Rural Health Transformation Program, and in the expending of state opioid settlement funds. 2. Use the RHTP to stabilize and expand core rural health services. 3. Support targeted reforms in emergency services staffing to promote regional models for EMS, fire, and police where call and volunteer systems are no longer sustainable. 4. Invest in prevention, community partnerships, and social drivers of health. 5. Build a stronger rural health and public health workforce pipeline. And lastly, 6. Expand telehealth and digital tools while preserving in-person options. Again, when we convene our statewide feedback meetings, the primary questions we will have for attendees are: does the summary of this chapter's challenges, successes, and achievements feel right and representative of your community? Which of the recommendations would make the biggest difference in your community? And what is missing? Thanks again for taking the time to review this chapter, and we look forward to speaking with you live soon. In the interim, if you have questions or concerns, please direct them to Mark Maloney, Communications Manager with the Franklin Regional Council of Governments. Thanks again, and take care.